Mr. DJ Harrell for a brief introduction.
Hi, I'm DJ Harrell, Polemark of Fort Worth Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated. Thank you for joining us today. I bring you greetings from all of the Panther City Newps as we engage in session 2 of our Kappa Konversations series. As always, we wanted to bring the most meaningful and impactful programming. Because there's no greater challenge facing our community today, we felt the need to discuss and share information related on how we defeat the COVID-19 pandemic. To that end, we've invited 2 of Tarrant County's most engaged and dedicated leaders charged with helping the community win the battle by advising our leaders and our community on ways to accomplish herd immunity and eventually defeat this enemy. It is our desire and expectation that you would also receive pandemic testing and inoculation information that spans geographical boundaries. I know many of you may be joining us from outside Fort Worth, Tarrant County, or even outside the great state of Texas. Please feel free to still pose your questions, as the knowledge shared here today will prove applicable to everyone, everywhere. Lastly, on behalf of Fort Worth Alumni Chapter, we are most grateful to God, our noble clan, our guest speakers, our medical professionals and first responders, and all of you for taking the time to view and share this information with your friends and family. Thank you.
Thank you so much, Brother Polemark. We really appreciate your encouraging words there. For my Facebook family, we want to thank you for joining us today. And we also wanted to advise that we would like for you to be a part of this as well. So please feel free to include your questions in the chat section. And as they populate, we will select certain questions that we will propose to the experts here today. And so without further ado, let's begin with the first round of questioning. And as I advised to the 2 gentlemen before we started, I'm just going to ask the questions, and please feel free to address them as you feel appropriate. The first question we have basically states, which lasts longer, immunity after getting COVID-19 or protection from COVID-19 vaccines?
So first of all, this is Vinny Caneja, Director of Public Health for Tarrant County, and thank you all for having me here this afternoon. That is a very common question that we get every day. Current data is showing that natural immunity acquired after getting the illness of COVID-19 currently is at least good for 90 days. It could be longer, but there are not studies supporting any longer duration at this point. There was a small study out of Europe that said it could be 5 months. But on the vaccine side, there are now studies showing that it could be 1 to 2 years of vaccine-related immunity, because not only you're getting a sort of a first dose with the vaccine that is giving you immunity, it's the second dose that's boosting that immunity up, and the efficacy is at least 95% with 2 doses. And a study out of Israel just recently showed almost 99.6% efficacy with the Pfizer vaccine. So there's a lot of promising things on the vaccine side. So longer immunity with the vaccine. And question always comes, well, which is better, right? Well, the vaccine immunity is better because you get it without actually getting sick. And that's the goal, right? You know, you got to get the immunity into most of your folks without making them sick.
Thank you so much for that. I definitely agree that getting the vaccine as opposed to getting the actual virus is definitely the direction to go. Next question. What percentage of the population needs to get vaccinated to have herd immunity to COVID-19?
That's another common question. There is really not a line in the sand, so to speak. Different opinions from different experts, but a general rule of thumb over multiple decades of working with vaccines has been that at least 70% of your population should have, immunity against a disease for the herd immunity concept to start working. And it's pretty simple, actually, that if you have enough people vaccinated, you sort of create a ring of protection around those who are either not vaccinated or can't take the vaccine for other reasons. For example, they may have immune suppression, like they might have HIV, or they might be on cancer chemotherapy that makes their immune system so weak that even if you give them vaccine, their response is going to be not as good. And there are people who are allergic to vaccine components, so they may not be able to take it for that reason. So you build enough immunity in your community, that the herd protects you, that protects the weak. So that's the concept. 70% is general rule of thumb, higher is better. And one of the things that people sometimes kind of gloss over is, the vaccine here for COVID-19 is very, very effective. 2 doses give you 95% efficacy. That automatically puts COVID on a list of diseases to be eliminated. Now, currently, it sounds like a tall order, right? I mean, you got to get the entire world vaccinated and herd immunity given, but over multiple cycles of vaccination, we've done this before with a few diseases, and we can do this again. It just needs the entire community to participate. We can't worry about the world, but we can talk about what can happen in Tarrant County. And I encourage, and I'm sure my friend Brandon is going to encourage everybody in Fort Worth, let's get vaccinated when your time's up.
Yeah, and I just want to add to what Vinny said, and that is, to get to that 70%, we're going to need everybody to participate. So if you look at the numbers that are out there now, and there's a lot of folks that have concern about the vaccines. They feel that the vaccines were rushed, and they weren't. They were expedited, and there's a difference between rushed and expedited. Rushed would imply that the safety measures weren't there, and that perhaps there's a higher risk, when in fact it was very well tested. We now 6 weeks, better than 6 weeks into vaccinations locally, and we're seeing about, like we were on the national side, about 15% of people complaining about maybe a little soreness where they got an injection, which is very typical when people get injections in the arm. And then we're seeing maybe 50%, maybe a little bit more with flu-like symptoms, which is the immune system reacting to the shot. And people get over that within a couple of days. But the big thing that I really wanted to capture, though, to add to what Vinny said, was that if you look at where we are now nationally, about 68% of Caucasian folks say, hey, I'm going to get the vaccine. And we know that they probably aren't all going to get it, but at least 68% say that they're going to. But that's only 40% of the population. So 40% is not 70%, it's 40%. And then you look at the African-American community, and we're seeing numbers as low as 30% of that community participating in vaccinations. We're never going to get to 70% if we don't get people of all color, of all cultures, of all age groups. It's going to take all of us participating in the vaccines. And in particular, we have to really pay attention to the African-American community, because we know that in some areas that the African-American community accounts for up to 60% of hospitalizations. And that is a high number. And so the more that we can get African-American, Hispanic, and other folks to participate in vaccines, the less hospitalizations we'll see and the better the outcomes.
Thank you. Thank you so much for that. As a society, we're familiar with getting vaccines to fight diseases, right? We've been doing it since I've been born, for sure, and prior to that. But we don't know a lot about what goes into these vaccines. So can you help us understand what are the ingredients in the COVID-19 vaccine?
Yes. So this is a brand new technology. The 2 vaccines that we have seen from Pfizer and Moderna, they're a brand new technology called messenger RNA. And before I explain that, let me explain what typically happens when you develop a vaccine. Usually you identify a virus, you isolate it in a lab setting, and you replicate it. For example, in the flu vaccine scenario, you grow it in chicken eggs over multiple generations. The idea is that you either kill the virus and you make the flu shot, or you weaken the virus and you make that flu spray that goes in the nose. And it takes a long time to do that. And the process itself is not very efficacious. It has its own design flaws, so to speak. But that was the typical development cycle for most vaccines. So this technology that we're currently able to see with these 2 Pfizer and Moderna vaccines, the first time they've been able to leverage that to make a vaccine against a virus. But the technology has been studied for almost 2 decades. Like in late, maybe around 2003, 2004 timeframe, they had started kicking the idea around for cancer vaccines using this technology. And they tried to develop a vaccine for SARS, which was the first coronavirus outbreak that we saw that became a pandemic. And but SARS went away quickly, so the interest was lost. And then over the years, they've been refining it, trying to develop cancer vaccines. So what they do in this particular situation is they take a genetic code out of the virus, and it instead of creating the entire virus in the lab, what they're doing is they're leveraging our body's immune system. So they give us something called a messenger RNA. It's a little snippet out of the virus's code. And all our body's seeing is, oh, I need to create the spike protein of the virus. And the spike protein is a little, I guess an extension on top of the surface that lets the virus hook on to your body cells. And that's when we tell our body cells to create that spike protein, it is actually mimicking what the virus actually does. It latches on to your body, inserts itself into your cell, and says, make millions of copies of me. And that's how you get sick. In this case, we're saying, don't make the virus, just make the spike protein. And once that spike protein is made, our body sees it as an antigen, as an enemy, and it mounts an immune response, making antibodies. And so it's a very smart way of dealing with viruses. You don't have to capture it. You don't have to replicate it in lab, which is not always easy. And it takes a long time to make vaccines that way. In this case, you can just take a copy and paste the genetic code and make a vaccine in a lab and get out pretty fast. And that's what you saw happening with the development of the vaccine. The time frame was very shortened because the technology allowed for that. And the success has been proven. It's safe with clinical trials. Like Brandon was saying, we're seeing that happening daily. People are getting the vaccine and staying healthy, minor side effects. So it's very, very safe technology, and it can be leveraged to create more vaccines down the road. So it's a very promising thing that we're seeing happening because of it.
Okay, thank you so very much. Brandon, you touched on a topic that I'd like to go back to for a second. You were talking about the reluctance of the African-American community getting the vaccine. So a couple of questions for Facebook came in regarding are Black churches, are they being considered as an opportunity to assist people in these communities to provide vaccines to them so that they may go and disperse to their congregations and to the communities beyond?
So yes, this is a conversation that we have every day, where you don't see conversation turning into action is, as a nation, we just don't have enough vaccine to implement a lot of the distribution logistics that we'd like to. And so here in Fort Worth, as an example, we're working with the governor's office right now to try to get an additional supply of vaccine to where we can work with fire stations that are in particular zip codes or particular neighborhoods, and work with Tarrant County Public Health. They have a single sign up website where people can go and sign up to get the vaccine, and then we can pull all the addresses around that fire station and then invite people to walk across the street or to drive just a few blocks to get the vaccine. This is being done on a limited basis, and we're working out the bugs, and as more vaccine comes in, we'll be able to do it at more fire stations and of course at more churches and other social institutions. We see that particularly in a lot of our communities as the best way, the best practice as the more vaccine becomes available, because those that are reluctant, those that have a fear, sometimes they need a little bit of leadership or to go hand in hand with somebody else to feel more comfortable about getting the vaccine. And Vinny, I think you have more that you probably want to add on what the difference is between a closed and an open pod and some of the things that you're working on.
Thanks, Brandon. Yes, I do want to share that, COVID is still an active outbreak in our community. So you're probably going to see more stuff done virtual like this on Zoom. And that's what we've done with some of the African-American churches in the area. We've gone and attended these Zoom or Facebook Live type of calls with their congregation, with their leaders, to explain what the vaccine is about and how safe it is, how it's being distributed. Because what we saw right away in the data was what Brandon was saying, that the sign-up rate was low in the African-American community and the Latino community. So we're making these outreach efforts. But as more and more vaccine becomes available, there's also a concerted effort underway to actually get out in the community, let local organizations help people sign up, and then drive the vaccine to them. Currently, we're having to bring people to larger vaccination distribution points called points of dispensing. They're open pods, so they're open to the public. But there's prioritization there that you must be 65 and older, or have underlying health conditions, or you may be a healthcare worker, or first responder. So there's some limitations, because on a weekly basis, we're getting, as a county health department, about 9,000 doses a week. And people that have signed up are 480,000. So we're having to apply some, I guess, rationing of the vaccine, which is going to get, better. I think by March, April, there should be more vaccine candidates and more supply. So that rationing will go away. And then what Brandon was saying is exactly the concept that we can create these closed pods that would be, hey, XYZ church, and we're only doing vaccine for that church and their congregation. That is part of the plan, but it's a little ways down. And it's a quicker way to get the vaccine out, so that you don't create a mad rush of people showing up at a site with thousands of people in line. You go into smaller groups. I'm going to pick an employer, work with their employee health, get the vaccine out there, get those folks done in a day or two, and then move on. So that's the concept. It will happen eventually in our community once the vaccine supply is much better.
Okay. And so, to the point that you just made, what can just a regular average person do now to help protect themselves from getting COVID-19 until the vaccinations are available, or the vaccines are available?
Yeah, very, very astute question. COVID outbreak is still pretty high in our community. Good news is that we peaked around the week of January 8th, and we're starting to come down in cases. But overall, when you look at hospitalizations, you look at case counts, you look at other factors that we normally track, we're still very, very high and in a very active outbreak in our community. So you have to protect yourself. And the things that work and have continued to work are wearing a mask when you're out and about and not with your family. When you're around anybody else, wear a mask. And if you can avoid large group gatherings, avoid those. If your work allows you to do something remotely, like a Zoom call or teleconference, try those. Try not to go sit in a big meeting. If you're working in a public setting, like let's say you're at a retail store and so forth, usually they have protection screens, like plexiglass, helping you and let you wear a mask. So those type of things. So don't go attend large group gatherings that are not necessary. Stay home as much as you can. If you're going grocery shopping, order online and pick up by curbside. Try not to go in the store, because more people there are in a group shopping, more likely there's going to be an outbreak. So those are general steps. The one key step, now that the vaccines are available, is that sign up to get the COVID vaccine. So our website that Brandon mentioned, is becoming a single portal. It's tarrantcounty.com/COVID shot. And again, it's tarrantcounty.com/COVID shot. So try to sign up there, especially for the African-American community. We know in Tarrant County, almost 45% of the African-American community has at least one underlying health condition. And as a group, we're almost 10% of Tarrant County is African-American. But from a sign-up standpoint, only about 6% have signed up, and only about 5.5% have received their vaccine. So we're low, almost half of where we need to be on a proportionate basis. I mean, not the entire community is going to get vaccinated because there was not enough vaccine, but even on a percentage basis, we're only getting half of the folks who we know are qualified, either by age or by underlying health conditions. So we need to improve that sign up, and nobody can do it for you, right? I mean, we can help, but people got to take the first step to get educated about the vaccine, feel comfortable about it, and then sign up to receive the vaccine.
Okay, that leads into another question that we had from one of our Facebook family members. What is being done to help those without computer access to sign up for the vaccine?
Yeah, let me share a little bit, and then Brandon, I'm sure will have more. So the county does have a call center, and I'll admit the call center is overrun with more than 5,000 calls a day. So the wait times have been pretty bad right now. But it does allow people that don't have computer access to call the call center and get signed up by letting the person on the other side fill out the form for you on the website. So the concept's great, but execution has been a little bit of a challenge because the call volume has been very high. So we executed an agreement with the UNT Health Science Center. As of Friday, they're helping us getting some of that calls answered. And the county is actually looking at some quotes from an actual call center company to put them in the mix. So it will get better over the next couple of weeks. The other thing that we're doing is, again, working with grassroots organizations that are now actually setting up a sign-up drive. Initially, when the weather is cold, they're doing it in like mall settings or at a church setting, letting people come to a desk and get signed up if they don't have computer access, or inviting them to a community center. But down the road, there are plans being discussed right now of actually canvassing the neighborhood and going door to door, just like the census people do, and trying to get people signed up. So that's an update, a quick one from a county perspective. And I know Brandon and I had many conversations about this, and his city council too. So Brandon, you want to share something from Fort Worth?
Yeah, and I think this Zoom call is a good example of how we get the word out. Not the only example, and not just what Vinny has already spoken to, because what we recognize in this day and age is, people sometimes like to say, hey, 95% of the population has a smartphone or access to the internet. But that doesn't mean that they have access to the information or they have access to building some type of personal or collective capacity to actually take action on information that's out there. And so I would invite everybody on Facebook and all of your members. My email address, I'm sure, is included in the chat part of this. If not, we can get that out to everybody. If you have ideas or you have different groups or organizations you'd also like us to reach out to, we're more than willing to do that. And I'll tell you, Vinny and I work 18 hours a day, 7 days a week. We were working all day today. And we took an hour or so off for this call, and then we get back to work. There's a lot to be done, and sometimes in that rush to get a lot done, we don't always see some of the most helpful ways of getting information out. So we'd also like to get feedback on that.
Okay, thank you very much. One of the, I guess, more recent topics out there are the mutating strains. There is concern that with this particular vaccine, will that address the strands that have not made it to American soil as of yet?
That's a very genuine concern. So let me explain how this works though. Viruses mutate all the time, and it's part of the replication process. And to just give you a simple version, it's wintertime, right? So we wear winter jackets, right, that have zippers. If you try to, zip and unzip fast, super fast, many, many times, invariably you're going to find that it gets kind of bad. It doesn't always close correctly, and then it kind of gets out of whack. That's exactly what happens if you let the virus replicate so many times at a very fast rate. It kind of mutates, and it's not by choice. Sometimes it's by accident, and sometimes that's good for the virus, and sometimes it's not. But a lot of times, what survives is what's good for the virus. It becomes more efficient at spreading. It can become more dangerous, or it may be faster spreading but less dangerous. So a variety of combinations can happen. So similar things have happened. I mean, we've had a worldwide outbreak, and of course, with the huge number of people getting ill, the virus has had opportunity to multiply a bazillion times. And so we're seeing mutations happen. They've happened several times during the pandemic. So what started in China was not the same virus that hit northern Italy. It had already mutated. What hit New York was not the same virus. that hit northern Italy, right? So already we saw that happening. What hit our West Coast was not the same. It had a whole different look and feel to it. So already we've seen those mutations. Now these vaccines, currently we know that they're effective against the strains, especially the one that is making the news about the UK strain. But there are some concerns about the South African strain, which is very well contained right now in South Africa. But if it gets out, there are concerns that the current vaccines may be less efficacious. Not like it won't work, but they may not be 95% effective. They may be 80% effective, and so forth. So here comes the fun part about the technology. If we were stuck with the old way, you got to isolate that strain, you got to build a whole other vaccine and get through all the process. Now that's why I like this messenger RNA technology. You copy and paste the new strains, a little snippet, and then you add it to the vaccine in the future generation. So it makes things very, very easy. So I have full confidence that, over time, our vaccine will be updated to meet any changing needs of the strains, mutating. But till then, we continue to have a responsibility to keep the outbreak at a low, because the more you allow it to replicate, more mutations you're going to find, and it becomes a race against time. So how can we keep it low? We've discussed: wear a mask, try avoiding large gatherings, try doing things in a different way. Don't go to grocery stores inside, order online, pick up in store. Same thing with the restaurant. Order takeout, bring it home. So things can be done differently. And if we can all do that, it keeps the virus at a low level in our community and stops the mutations, because it doesn't have the opportunity to replicate. Brandon, you want to add anything on that?
Yeah, just to add that, I think that as Americans, in our very open culture with Facebook and Twitter and all the news feeds that we get addicted to every day, that it's very easy to get overwhelmed by the negative news, or to get overwhelmed by the one in a millions that are out there. And we forget sometimes to stay focused on where the odds are in our favor. And I was a early recipient of the virus. All the way back in April, I had the virus, and I'm 10 months in at this point. I have natural antibodies. I'm probably one of the longer cases for that. But the truth of the matter is, I know I'm going to improve my survival chances by getting the vaccine. So even though I have some natural immunity because I survived the virus, I know that my odds of survival are greater with the vaccine. I also know that my odds of survival are greater if I wear a mask. If I avoid social gathering, if I do all the things that we've been telling people to do, if I practice those myself and get my family to do it, we're going to be okay on this. And I think that's what's probably more critical about these different strains, which is that they're still somewhat outliers. And the better we do at protecting ourselves, the less opportunity those outliers have to impact us and our community.
Okay. So I'd like to touch on something that you briefly mentioned, Brandon. When it comes to those one-off scenarios that you hear about in the news and the media, right? That helps to foster mistrust within the community. Personally, myself, I saw a video of a young nurse that had been transferred to New York, and she advised that her experiences there were heartbreaking because, and this is just the information that I'm getting from the news outlet that reported it, but she advised that, there was malpractice that was occurring where doctors were not doing everything that they should have been doing to take care of the patients, right? So that's one thing. And on December 23rd, a young lady by the name of Tiffany Dover, she was a nurse manager from Chattanooga, Tennessee. She actually fainted on camera shortly after obtaining the first round of the vaccine, right? And so as professionals in your field of medicine, can you please address the situation regarding, those one-off situations, and provide your perspective on what you believe occurred, in these situations to help boost the confidence of those that have concerns about what has occurred.
And I'll just touch briefly on this, and I know Vinny will have some real good facts and follow up to it. But I can tell you, first and foremost, one of the things that we have to do is we have to confront the fact that as a nation, we didn't do a very good job of communicating early on. And I'm not going to get into all the reasons for that. I think many of them are self-evident, but at the end of the day, there was a lot of things that happened on a national and regional level that didn't go very well. That people were led to believe, oh, it's just a few people, will be okay in a week. We were led to believe, okay, it was more than a few people, but we'll be okay in a month. We heard early on that herd immunity was if we could get 40 to 50, maybe 60% of people that have the virus and have natural immunity, we'll be okay. And all of these things were untrue, and they led to a lot of mistrust on the part of the public. And it's something that people aren't going to get over anytime soon. We know that. And that's where I am very happy to see the new information that's coming out from the Biden administration and from the CDC and others, where one of their commitments is to communicate in such a fashion to where we are relying on science and not politics, that we have the experts that can get up before cameras and speak freely, not based on what's happening in the economy, but what's happening to the people that live and work within that economy. So I think that we will over time dispel some of that concern, but it's still a concern to reckon with. So I want to, number one, recognize that it was created, and then number two, say that you should be getting a lot more, you will get a lot better information moving forward. Vinny, did you have other things to add to that?
Absolutely. So totally echo, a lot of the messaging was different than what your public health professionals and scientific experts were saying. It was almost like, yeah, okay, those folks said that, but let's do it this way. And that made it really hard for the public to understand which message to follow. And so giving, more of a direct answer to what may have happened to that nurse who saw what she thought was malpractice in New York. I can tell you that New York had an early crisis with a huge outbreak and lots of deaths. And people don't understand that it puts a huge burden on the healthcare staff, people having to triage and make a decision. Okay, this person is really old and is going to die despite our best care. And here I have a young, healthy person with COVID, may be able to save that person. That's a very hard moral, ethical dilemma to kind of figure out who to give care to and what kind of care. We really hope we don't get there here in Tarrant County. We've come close. Hospitals have had to triage lately on who gets ICU care and other things, but it's not gotten as bad as what we saw in New York. And so she might have seen some of that happening and may have understood to be malpractice because people were having to make decisions on the fly, who gets care and who does not. So that's one issue. And the issue about actually the nurse fainting on camera, it's a common thing that can happen with any vaccine. When you stick a body with a needle, a lot of times people don't like that. That's one thing. But the second thing is when you give it an antigen, something to fight against, your immune system responds immediately, right? It sends a lot of effort. And how the body naturally works is it actually pulls all the blood into the pit of your stomach. That sinking feeling that you get, oh, I'm getting dizzy, that's actually your body's natural response to getting a huge bolus of an antigen saying, go fight it. It passes away a little bit in a few minutes, like 10 minutes or so, the person's fine. They may get a little sweaty. They might get over that dizziness with a little nauseous feeling, but it happens to quite a few people. It's a normal response of the body to just getting stuck with a needle and something being given. Not just with vaccines, but even antibiotics you might get in a hospital that are injected, or somebody's giving blood at a donation drive. They can have a similar response. It's called a vagal reflex, right? So your body actually responds that way. So yes, Can it be scary? Can it be disturbing to folks? Yes, it can be. But it is a common part of just getting an injection of any kind. And that's why when we do these vaccinations, we have medics there, we have nurses there. We try to make sure people are sitting and being observed for a few minutes after the vaccine. It's a common practice. Now, we're following it more, even at a mass vaccination level with COVID. There are people who were making wait 15 minutes, and people with history of those kind of reactions were making wait 30 minutes, because we want to watch them before they leave, because it does happen. But many other vaccines have it, HPV vaccine or chickenpox vaccine, many other vaccines have a similar reaction. And it's not because of the vaccine, it's because your body is getting injected with a substance. That's all.
Okay. Thank you so much for your perspectives on that topic. It's a very serious topic that I don't know if there were a lot of answers out there for. So to have you here speaking to that, that's definitely beneficial. We have a few more questions from the Facebook audience. There have been reports of the lack of adequate capacity for vaccines. I fear that I may be able to get the first dose, but the second dose won't be available. What is being done to prioritize or ensure that this doesn't become an issue?
Yeah, so vaccine is in short supply, but what we've been reassured many times is that if you give out the first dose, we will make sure you have the second dose. So that's what our experience has been, that we get our first dose allocation, we give it out, and then the second dose will show up just in the nick of time, right? So we don't have a whole lot of notice. Sometimes it's like the day before, we got them, let's go, right? And we are prioritizing those folks that are due for second doses so they don't miss it. But good news is that you have time. You don't have to just get it the same day. That is a preferred method, right? You complete the series, but just in case the provider that you got your first dose from is out of your second dose and hasn't received the supply, they will call you as soon as it comes in. CDC has said that it is okay up to 6 weeks from the first dose. If you don't make it at the 21 days for Pfizer or 28 days for Moderna, it is okay up to 6 weeks to receive that dose. They have data to show that it still works at the same level. Beyond 6 weeks, they don't have data to prove, but the general rule of thumb is that it will be fine to receive it after as well. Now, that is advice for providers, not for the public. Don't miss it on purpose. Don't let your calendar get in the way, right? Because again, you probably saw news coverage, oh, there's long lines. You know how those are long lines? Because people missed their appointment call and then showed up at an uninvited time and degrading the experience for everybody. We're not going to say no, we're going to try to see you. But the problem is then, you're there without an appointment for that day, and there are hundreds of people who showed up with their appointment. And as more and more people start doing that, it degrades the experience for everybody. Same thing with second doses. Try to keep your appointment time. When you leave from a provider, they usually give you a white CDC card that tells you this is your due date for the second dose. Block it off on your calendar, because very likely on that day, you will be invited to come back. Now, it may move up a day, it may move down 2 or 3 days. We're all having to do that because, again, it's a nick of time supply of vaccines. And you have to manage all of these hundreds and thousands of people that you're inviting for vaccination. But it is getting done. And we have a few people that have missed their doses and showed up the next day. We take care of them, but we can't take care of too many of those because it just really degrades the experience for everyone.
And to add just a little bit to what Vinny said, that we have the capacity to actually distribute probably 3 to 4 times the quantity of vaccine that we're getting right now. So to assure your listeners that if the federal government said, here's 4 times the supply, we wouldn't have to change anything. We would just schedule more appointments every day, maybe go a little bit longer into the evening. And we're also working on some large mass drive-through locations so that as the vaccine becomes more available, that we'll be able to get even more people through the process. And then as that vaccine becomes available, we'll have doctors' offices that have it, pharmacies will have it, and then there'll even be some private folks from the private industry side that will be setting up sites throughout different communities. Everything hinges on increasing that supply. And that's why it's critical that we get everybody to continue to social distance, wear their mask, get signed up, do all the things to protect yourself so we can get through these few more weeks or a couple of months to the point where you'll start seeing your general population get invited to get the vaccine and moving through fairly quickly.
Okay, thank you. Thank you very much for that. We have a few more questions here before we wrap up. I see a couple that have stood out to me. How long should you wait to get the vaccine if you've already had COVID-19?
So that's a common question we get. So the current recommendation is that if you have active COVID, don't go to get the vaccine. And if you are quarantining because you've been exposed to a family member or a coworker or somebody that had active COVID, don't go while you're quarantining. After that, there is no restriction. It's your choice. People who have recovered from COVID, we know that at least for 90 days, they have natural immunity. So they don't have to get the vaccine. There's no requirement. There's no need for them to go get the vaccine. But if they feel strongly about it, they don't want to take any chances, we're not saying no. Well, we've had several people that had recovered for COVID 2-3 weeks ago and came in and got their dose. It is absolutely fine. And we educate them. Hey, if you want to give up your dose for somebody else who may need it, that's fine. Some people have. And some people are like, no, I don't want to deal with this again, so I want my vaccine. Absolutely fine. So short answer is that there is no restriction, only when you have the active illness or if you're quarantining. After that, you're okay to receive the vaccine. You don't need it for up to 90 days. After that, we recommend that you do go get it.
Okay. Is it safe for me to get a COVID-19 vaccine if I am pregnant and or breastfeeding?
So there are limited data sets to show what is happening with pregnant women and lactating mothers. Generally, what we understand from the technology, it causes no problem. There's a video that just made the news a couple of days ago. One of my staff, she's pregnant. She did her own research, talked to her doctor, got the vaccine, first dose and second dose. So worth watching that video. Listening to an expecting mom is better than listening to me, right? But the short answer on that is too that you should talk to your OB provider and see if they recommend it based on your health condition, should you get the COVID vaccine. From a CDC perspective, from our perspective, it is absolutely fine. Risk of getting COVID and having serious implications for yourself and your baby are much higher than the risk of getting vaccine, right? So, can you get the vaccine and feel sick with it? Sure, it can happen to anybody with any vaccine or any injectable medication, but the risk is higher if you actually get COVID. So my advice would be talk to your provider, and then if you make up your mind, you come get the vaccine.
Okay. This question has popped up a couple of times here. If I've already received the vaccine and I've already received the booster, why should I have to continue to wear a mask?
Yes, that's a great question. Again, it's limited knowledge at this point on how the body actually would work with the vaccine. Generally, when you're vaccinated against the illness, you don't get it and you don't transmit it. There's not enough time passed to show that we're going to, we know that we're not going to get it because they've done it in the studies to find that out. The issue is, are we going to silently spread it to others? That's one question. And two, wearing a mask is sort of a social thing, right? So everybody needs to wear a mask so that we can protect the entire community. And there are people who silently spread the virus. And there's no real good way for us to start waving like an immunity card. Hey, I'm not wearing a mask because I'm vaccinated, right? So that creates a lot of confusion and distrust on why the person is doing it. So it's best till COVID comes down to a very low level where it's not a problem, kind of becomes like the flu every year. When it comes down to that level, that's when we would probably give up on all those measures about wearing a mask, staying socially distant, and all those types of things. And the goal is to get there, hopefully this year by the end of fall and going into winter, If we can get enough people immunized, we should get there. If the community does not participate in immunization, then we're going to have to hang on longer to these masks. Brandon, you want to add anything on it?
No, that was really good. I mean, look at before we even had vaccines, that it was almost a political statement, or it was a political statement for a while, that if you're this political affiliation, you don't wear a mask, and if you're this one, you do wear a mask. And you see the spread that occurred as a result of folks not wearing masks. And what we want to do is we want to be able to get through over the course of the next 6 months, to get through this, get the herd immunity, and then get the economy and other things starting to open up to get back to some sense of normalcy. The more that people don't wear masks, the less likely it is for that to occur. And I agree wholeheartedly with Vinny. I had the virus early on, and I really wanted to say, I've had it. I'm not a risk to myself. I'm not a risk to others. But the science just isn't there. And I continued to wear a mask just like everybody else did. So Vinny's spot on that.
Absolutely. And let me address something else that has just recently come with the new variant, right? The UK variant is 1.5 times more infectious. And we found it in at least a couple hundred cases across the US. And the assumption is that it's around a lot more. It just hasn't been found because there was not a concerted effort to test for it. So there is now a recommendation that we're getting vaccinations out, but till we know exactly how the vaccines are going to be able to curb all of this. People are wearing this thin cloth masks. A lot of times the quality isn't there. They're just made by somebody, right? And so double those up, triple those up. People are not liking the idea, but there's good science behind it. As you put layers, it filters more. And it's not just that it's going to protect you from the virus because you're wearing it. It's protecting others from what you might be spitting out of your mouth as you talk or you cough or you breathe. And it's a source control strategy. So that's how it really helps. And more layers you can put on, the better it is. Now, the medical professionals, they can wear the N95 mask and get a good fit and all that. But let's leave that to the medical professionals. As common public, we should be wearing a good surgical mask, or the procedure mask if you can find one. Those are in short supply too. But if you're wearing a homemade cloth mask, make sure that it's got a couple of layers. And if you don't have one, if you just have a single layer cloth mask, put 2 of them on. It doesn't hurt. And it protects you and protects your family. If you're not vaccinated in particular, you could be bringing it home to your family members and silently spreading COVID and not know it. So it's a very good idea to wear those masks.
And a good way to test whether your mask works or doesn't work in a typical community situation is take a piece of paper and you lay it on a tabletop, and then without any mask on, blow that piece of paper, and you'll see it floats across the table and onto the floor. Then put on your typical surgical mask and blow as hard as you can, and that piece of paper is not going to move. And then you'll have in between masks that a lot more air is getting out. Anytime you see that piece of paper move, your mask isn't providing the level of protection that people around you and your family need. And remember, a surgeon doesn't wear a mask to protect himself from the patient. The surgeon wears a mask to protect other people from the surgeon's germs. And that's the same way with masks. So I would invite people that have made their own masks or using neck gaiters alone to kind of do that experiment, particularly with kids. It's something that they really find fascinating.
Okay, well, thank you. So what I heard was that, one of the reasons why we're still providing the message of wearing masks is because we're still so deep within the zone of unknown, and things are changing every day. Things are evolving every day. And until we can get to a point where the science will back up the results, safety first. So I'm completely there with you. Well, gentlemen, I want to thank you so very much. This ends our round of questioning. I will, before I close it, I will leave both of you with an opportunity to leave our viewers with whatever is lingering, within your mind that you want to make sure that gets out there.
Well, sure. Well, thank you folks for listening to us, and listening is one part of the effort. I want you to take action, right? Wear those masks, stay home, only go to important things like going to work or a doctor's visit or getting groceries curbside. So try to do those things in real life. It will help us drive down COVID numbers in our community. And sign up for the vaccine at tarrantcounty.com/COVID shop. Even though you may think you're completely healthy, don't need it, may not qualify for it, that's fine. You're signing up early, and when the vaccine is open to the larger groups, your number will be up sooner. You won't have to wait in line with a lot of other people signing up at that time. So do all of those things, and when your number is called, come get the vaccine. That is a sure shot way to end COVID now. Thank you.
And yeah, you know, I really thought we would get a question about equity on the call today, or that would come up. And I don't feel that I can leave this conversation without making sure that I make a point to say that I have seen more conversation about equity in the last 18 months than I did in the first 20 years of my career. And I'm seeing much better result because of that. And I would encourage everyone to continue to have the conversation about what is possible, not about what the obstacles are. And in this particular case, when it comes to protecting populations, when it comes to vaccinating populations, me and Vinny, we don't have all the answers. We need people to be working alongside of us, and we need people to be providing us with creative solutions that maybe we didn't think of. And so again, I just want to make sure that we leave this conversation with some encouragement to folks out there that reach out to us if you have some ideas, or if there's other ways that we can reach out to different groups or have an additional presentation like this to other groups, because that's really what is going to produce much better outcomes in the long run.
Okay, and I will have to apologize. There was a question that was provided earlier on that I missed, but I believe was a very important question. What is the time frame for being able to provide a vaccine for younger adults and children? And what is the youngest age that you would recommend having a vaccine?
So currently, there are 2 vaccines approved. The Pfizer vaccine is approved for 16 years and older, and the Moderna vaccine is approved for 18 years and older. And so that's the lowest we can go at this point. There are new vaccine candidates, that are making it their way for FDA approval. So we'll have to wait and see if they have any that can go with a younger age group. Typically, with brand new vaccines, it takes a little bit of time to let them be in the community to see what the impacts are before they're opened up to children. So my personal expectation is somewhere in the summer, before the fall season opens for schools, there's going to be enough time and data to show the safety and efficacy, and they might get a revised approval and emergency use authorization from the FDA to open up to the younger age groups. Anybody at that point that is eligible, there is no limit, right? So they'll set the limit saying we can give it to 6 months and older, or 2 year and older, or whatever the age group may be. Just anybody in that age group needs to come get the vaccine. It should be available by then in a wide variety of settings, at doctor's offices, at pharmacies, at drive-through locations, and other large dispensing sites. So don't miss the opportunity to get vaccinated, especially your kids, when the time is right and when they're eligible to receive the vaccine.
Okay. Well, once again, thank you, Dr. Taneja. Thank you, Brandon, for joining us on our second edition of Kappa Conversations. I'd like to speak directly to our Facebook family. We really appreciate you for joining us today. We will look forward to speaking to you for our next session as well. And if you have any concepts or ideas or topics that you want to talk about, please feel free to DM us and let us know, and we'll take a look at those. Also reach out to us on Facebook at Fort Worth Kappas. And until next time, make sure that you all are treating yourselves well, make sure that you're following the science, and make sure that you keep yourself safe. Have a great day, guys.
That's right.